Hey everyone, welcome back to the channel. Today, we're diving into a topic that's surrounded by a lot of curiosity, myths, and even some unnecessary shame: masturbation and prostate health. Specifically, we'll be exploring how daily masturbation might impact your prostate over time. This is a topic that affects millions of men but often doesn't get the serious attention it deserves. So, let's break it down clearly, scientifically, and without any judgment. First, let's quickly cover what the prostate is and why it matters so much. The prostate is a small, walnut-sized gland located just below the bladder and in front of the rectum. Its main role is to produce a fluid that, together with sperm cells from the testicles and fluids from other glands, makes up semen. Essentially, it's a vital part of male fertility. But the prostate isn't just important for reproduction, it can also be a source of significant health issues as men age, like prostatitis, inflammation, benign prostatic hyperplasia, BPH, or prostate enlargement, and even prostate cancer. Now, when we talk about masturbation, or self-stimulation that leads to ejaculation, we're talking about a very natural and common activity. Studies show that most men masturbate at some point in their lives, and many continue doing so regularly into older age. But how does this daily habit affect the prostate specifically? Is it harmful? Is it helpful? Let's look at what the science says. Interestingly, research has increasingly pointed toward positive effects of regular ejaculation on prostate health. A landmark study published in the journal European Urology in 2016 found that men who ejaculated more frequently had a significantly lower risk of developing prostate cancer. Specifically, men who ejaculated 21 or more times per month had about a 20% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. That's a pretty striking difference. So, how could ejaculation, whether through sex or masturbation, have this protective effect? One theory is that frequent ejaculation helps flush out harmful substances that could accumulate in the prostate over time. Think of it like a cleaning system. Regular emptying prevents the buildup of potentially cancer-causing agents. Ejaculation may also help reduce inflammation and stress in the prostate gland, both of which are factors believed to play roles in the development of prostate problems. Additionally, regular sexual activity, including masturbation, can improve circulation to the pelvic region. Better blood flow means healthier tissue and a lower likelihood of stagnation and infection, which could otherwise lead to prostatitis or other issues. It also appears to help maintain normal prostate size, reducing the risk of benign prostatic hyperplasia, which can cause uncomfortable urinary symptoms as men get older. But before you think, "Perfect, I'll just masturbate every day and guarantee a healthy prostate," there are a few important caveats to consider. Balance is key. Just because a little is good doesn't mean more is always better. Daily masturbation, especially if done compulsively, can sometimes have negative side effects, not so much on the prostate itself, but on your mental, emotional, and even physical health. Compulsive masturbation, where someone feels out of control or uses it to avoid emotional issues, can lead to feelings of guilt, anxiety, or even interfere with daily life, relationships, and work. Plus, overmasturbation, particularly if it's aggressive or frequent without adequate recovery time, can cause irritation, soreness, or even temporary inflammation of the urethra or prostate, sometimes referred to as prostadynia. It's rare, but it's something to be aware of if you experience pelvic discomfort after frequent activity. Another aspect to consider is the method of masturbation. Using excessive pressure, rough techniques, or even inappropriate objects can physically injure delicate tissues around the penis and prostate, potentially causing inflammation or trauma that might lead to chronic pelvic pain syndrome. Therefore, while daily masturbation itself isn't inherently harmful, the way it's practiced matters a lot. It's also crucial to remember that masturbation is not a substitute for regular medical care. Even if you're ejaculating regularly, you still need to be aware of warning signs for prostate problems. Symptoms like frequent urination, painful urination, blood in semen or urine, pelvic pain, or difficulty urinating should never be ignored. Regular checkups with a healthcare provider, especially after the age of 40 or if you have a family history of prostate issues, are essential. Now, let's touch on another dimension: psychological health. Some research suggests that sexual activity, including masturbation, can reduce stress levels, promote better sleep, and even boost mood by releasing feel-good hormones like dopamine and oxytocin. Chronic stress has been linked to a weakened immune system and possibly even greater cancer risk, so maintaining a healthy sexual outlet can indirectly support your overall prostate health by helping you manage stress better. Moreover, maintaining overall physical health is crucial for prostate health. Regular exercise, a diet rich in fruits, vegetables, healthy fats, and lean proteins, staying hydrated, and avoiding excessive alcohol and tobacco use are all foundational steps. Masturbation can play a role within a broader lifestyle that promotes prostate wellness, but it's just one piece of the puzzle. In summary, daily masturbation appears to have more benefits than risks when it comes to prostate health, provided it's practiced in moderation and with proper technique. Frequent ejaculation can help flush out the prostate, lower the risk of cancer, improve circulation, and even support emotional well-being. However, compulsive behavior, rough handling, or ignoring broader health habits can cancel out some of these benefits. If you find that masturbation is becoming a problem, for example, if it's interfering with your daily life, causing physical discomfort, or leading to emotional distress, it might be worth speaking with a healthcare professional or counselor. There's no shame in seeking help, and your mental and physical health are deeply connected. At the end of the day, it's important to view masturbation as a normal, healthy part of many people's lives, not something to feel guilty or anxious about. By staying informed, being mindful of your body's signals, and keeping up with regular health checks, you can ensure that your prostate and your overall well-being stay in great shape for years to come. Thanks so much for watching today's video. If you found this information helpful, be sure to like, subscribe, and hit the bell icon so you don't miss future videos on men's health, wellness, and more. And if you have any questions or personal experiences you'd like to share about this topic, feel free to drop a comment below. We love hearing from you. Stay healthy, stay informed, and I'll see you in the next video.